I'm now very pleased to introduce Mike, James and Caris from Deafblind UK, who will be talking about reconnecting after the lockdown. Mike, James and Caris will be taking some questions at the end of the session, so if you have any questions, please type them into the Q&A window and we'll hopefully answer those later in the session. Enjoy. Over to you, Mike.
Thank you very much, Andrew. Hello, everybody, and welcome along to this session, wherever in the world you may happen to be. My name is Mike Wycherley, and I'm the Head of Charitable Services here at Deafblind UK. Many thanks to you all for joining this discussion session today. I'm sure you will all agree with me that the sensory loss community is incredible. There are remarkable people doing remarkable things every day. It also includes a far larger proportion of our fellow citizens than many people may realise. During the past 3 years, as a result of the unprecedented impact of the COVID-19 pandemic, many individuals within this sensory loss community found themselves becoming cruelly marginalised and isolated. Shielding, staying at home, finding it hard to get accessible and accurate advice and information, and for some, of course, still reliant on touch to help them to understand and navigate the world around them, yet terrified that this actual act of touching could potentially prove fatal. We at Deafblind UK, alongside other organisations, many of whom are represented amongst our attendees today, worked tirelessly to rapidly develop the most relevant and vital services to support people through this long and bleak period in many practical, technological and psychological ways. Now that the darkest days are hopefully behind us, every one of us has the opportunity to play our own part in making the future better than the recent past for people in our own local communities who are still trying to re-engage with normal, social and productive lives and the activities and freedoms that they should all be able to enjoy. So, we are hoping that this section of today's conference will help us all to think about what more we can achieve, both individually and collectively, through collaboration, conversation and shared learning to promote the reconnections that still need to be made between many deafblind people and their local and wider communities. We're very keen for today's conference to be the starting point, as Nikki mentioned at the beginning of the day in her address, for longer, richer conversations and relationships. So please do keep in touch with us over the coming months if you wish to play a part in this positive change and to create an immediate, transformative and lasting legacy. Now, one of our local members who we've known for several years, certainly since from before the pandemic, put the recent period into sharp perspective when we spoke to him. He told us, "Before I was part of Deafblind UK, I felt like I was locked in a cupboard with only a speck of light coming in." He said Deafblind UK opened the door and let friends and confidence in. I could meet with other people and we chatted about rubbish mostly, but it was finally a conversation that I was included in. Then, in the pandemic, he said, that door closed tightly again. Last year, we conducted a survey of over 1,000 people with some level of dual sensory loss. It concerned us greatly to learn that no less than 64% of our respondents felt that they had lost all confidence or motivation to participate in active or social opportunities outside of their own homes. Some of the quotes we gathered during that survey are quite emotive. One lady told us, "I can't tell you how grateful I am for your call today. I won't lie, I am terrified." During and since the pandemic, the contacts and feedback that we've had with our community, including people with sensory loss themselves, their families, carers, and the professionals that often support them, have given us a deeper level of understanding of their fears, concerns, needs, and aspirations. From this feedback, 3 key themes have emerged. They've continued reappearing more than others when discussing people's feelings about re-engagement with their community. These 3 recurring themes are, number 1, that their self-confidence was very low and they were fearful about being out and about again. Number 2, that their physical mobility had deteriorated and would need to be gradually redeveloped if they were to be independently active again. And thirdly, that they believed that the things they wanted to do or the places they wanted to go to were not accessible to them anyway, even if they did have good confidence and mobility. It's each of these 3 key areas of challenge, confidence, mobility, and accessible opportunities, that we'd like to discuss briefly during this session today. Our internal response to the feedback was to work out project plans that addressed those 3 priorities in a very person-centered way. We've been able to roll out variations of this project across the country, primarily under the Reconnections title in Northern Ireland and parts of South Wales, and as the Friendship Guarantee project in other parts of Wales and across the whole of England. It always begins with a conversation, which effectively gives the individual a chance to explain their own particular feelings in respect of those 3 key areas of challenge, and also for them to tell us what their aspirations actually are. That is, what's important to you and what would you like to be able to do? We take a holistic approach, which may lead into some of our other service areas, such as mental health and emotional support, casework perhaps, or technology support. And of course, we explore those 3 key areas: confidence, mobility, and social opportunity. We then make our suggestions and offer a clear, progressive, and achievable set of options to help the individual try to overcome the challenges that are preventing them from moving forwards independently. Within our service, the confidence and motivation side of things is addressed through individual support from a key worker or a project officer, backed up, as I mentioned, by our multi-tiered specialist emotional support and well-being service. To improve or enhance mobility, we connect people to localised rehab and fitness services, walking or exercise groups, gyms, leisure centres, and so on, and we offer upskilling support to the providers of these activities, so that they feel able to support deafblind people effectively. We also assist people by exploring their various local transport options, and in those Reconnections project areas I mentioned, namely Northern Ireland and South Wales, we've also been able to introduce some volunteer mobility buddies who provide one-to-one support to help somebody become active again and to regain their independent use of local transport options. We address the issue around the accessibility of mainstream social opportunities by administering something we call the Deafblind Friendly Initiative, in collaboration with the particular venue or the opportunity that the individual has themselves identified as being their preferred social opportunity. The Deafblind Friendly package is basically a detailed self-assessment and support package that helps a provider to recognise and implement ways in which they can ensure good service, inclusivity and accessibility for people with sensory loss. And once again, this is backed up by our provision of awareness upskilling for staff and volunteers of these social opportunity providers. Regardless of who that turns out to be, maybe the Grand Master of the local Masonic Lodge, it may be the lifeguards in the local swimming pool, or even the staff behind the bar in the local pub. It doesn't matter. It's the deafblind person's choice that matters. So that's just a brief outline of some of the ways in which we've tried to meet the needs expressed by people with sensory loss, based directly upon what they have told us. And of course, there are many everyday actions and attitudes that can be followed by all of us, which will allow us all to be part of the wider global solution, regardless of our own circumstances, age, location, job, or other priorities and personal responsibilities. These small personal acts don't need to form part of a volunteer programme or a formal project or a service like the ones that I've just described. No. It's just how a civilised, caring society should automatically operate. We can all contribute to this important cause, I'm sure you'll agree. So now over the next few minutes, we're just going to have a few words from a couple of my regional colleagues, whilst we focus on each of those three key areas: confidence, mobility, and social opportunity. Firstly, I'm delighted to introduce Caris Jones, who, in partnership with her colleague Julie Jones, forms the team delivering our Reconnections Cymru project in South Wales, for which we are very grateful to receive support from the National Lottery Community Fund. Caris is going to share some observations with us on the subject of confidence. Thank you, Caris.
Thanks, Mike. Good afternoon all. I hope you're well. As Mike just mentioned, I will be touching on the impact the COVID-19 pandemic has had on the confidence of deafblind people and the enormous challenges associated with it. Although normality is potentially on the horizon for many of us, we are still facing challenges that notably impact lives. These impacts come along with challenges that need to be tackled daily. Due to the pandemic, we have seen significant changes in our members' daily routines and lifestyle choices. This may include staying at home more, still wearing face masks, observing social distancing, and pursuing fewer social opportunities. Deafblind people have told us that all of these factors have resulted in a loss of personal confidence and questioning of what a normal day looks like. The impact on normality and routine is a challenge that is incredibly important to tackle, as self-confidence will only continue to deteriorate if this is not addressed. One major contributory factor has been the lack of accessible information given out throughout the pandemic, and particularly post-lockdown during the slow transition back to normality. For all of us at times, The uncertainty was alarming. However, for a deafblind person, the uncertainty only led to the deterioration of confidence and confusion around what was and still is expected of them in terms of social interaction with others. The constant changeability, even 2 years on from the final lockdown, may have had a long-lasting effect on confidence for someone who is deafblind. This could well be because of the lack of accessible information that followed the pandemic. An example of this is from an elderly deafblind lady in South Wales. She's told me that her confidence was completely stripped from her in March 2020. Along came COVID-19, with a worryingly long list of other impacts that later followed. The absence of social interaction, clear guidelines, and any significant support meant that she was left alone to deal with what she would consider the most difficult time of her life. She actually once said to me that it's been worse than the war. Now that lockdowns and restrictions are hopefully behind us, this lady still abides strictly by the COVID-19 guidelines, and she doesn't leave her home. This is because of the lack of clear, accessible guidance and information for deafblind people to follow. She relies on charities like Deafblind UK to support her. She's no longer trusts news agencies who scare her with extreme information that she doesn't understand. She's lost all confidence within herself. This lady from South Wales represents many deafblind people, which is why reconnecting initiatives such as projects we run are so important. The uncertainty really has knocked the confidence of many people we support. Interaction loss is one of the biggest challenges to consider when discussing confidence, especially when it comes to asking for help and reaching out to people. With so much time passing since many people regularly felt comfortable communicating in a face-to-face situation, these interactions can now seem daunting and difficult. Many people appear to be suffering in silence and accepting that this is just how things are now. Asking for some help around social connections has become overlooked, particularly as new challenges and priorities, such as the cost of living crisis, has emerged more recently. The Reconnections project my colleague Julie and I work on in South Wales has been created to help overcome some of the barriers mentioned. Deafblind UK sensory support officers across the UK are hoping to support our members in regaining their confidence to live a fulfilled life, whatever that may mean to that individual. Confidence levels will need to continue to grow until such time as a new positive, active, and hopefully hopeful normality is reached, which we can only hope will be sometime soon.
Yeah, thank you very much, Caris. I'm sure we all echo that sentiment. I think this is a good moment for us to just make our interpreter change, so we'll just pause for a moment at that point. We're now just going to focus briefly on the second of our two key elements, which is mobility, or perhaps the lack of it. As I mentioned earlier, from our informal conversations, we knew that many of our service users and beneficiaries were telling us that their fitness had decreased significantly during the pandemic. We must bear in mind, of course, that even in good times, sensory loss and deafblindness can affect balance, for instance, for many people. When you couple this with being inactive for a length of time, it can create problems that are difficult then to overcome. Earlier on, I quoted that worrying statistic from our survey, in which 64% of respondents told us that they had no motivation to engage with anything active. Well, 36% of all the people we consulted said that they would really welcome some help to become more physically active again. A quarter of all those we contacted said they would just love to be able to go out for a regular short walk and a bit of fresh air. I'm sure you'll agree that simple, localised starting points such as a gentle stroll around the block are the essential beginnings to someone regaining their capability for being actively independent again. But beyond that physical mobility challenge, there are also the practical and psychological issues that someone re-engaging with community life may need to overcome. One gentleman told us, "It has taken a while for me to feel up to heading back out again. So much has changed in the community since last year. I'm not even sure how to navigate it anymore." And I think that's an important point to remember about mobility. It's not just about physical capability. It's also about the ability to navigate, to find your way, and to make use of transportation options, for instance. I'd like to just share with you some comments that were made by participants at a workshop style event that we were involved in the north of England not too long ago, which also focused on this same topic. One lady, and she was a local authority support worker, said that I wish it would be possible for a nationwide home visit scheme on an individual client basis in their homes for regular balance and strength training sessions, indoor mobility practice, outdoor mobility practice, including getting in and out of cars and using buses. She said, "I try to help some clients in this way, but it should be a wider service, and I'm not really skilled to support the specific needs of deafblind people with their challenges." Another participant at that event observed, "There's often a disconnect between many people with poor mobility and fitness schemes such as leisure centre passes or walking and rambling groups. These don't address the basic first steps need to help people get up from their chairs and out from their homes for some gentle daily exercise to build up their strength and balance." And I recall that that comment was then followed by a discussion during which representatives from several local authorities all agreed that they were not aware of such schemes having been discussed in their areas as part of an ongoing preventative wellbeing planning strategy. But again, I feel these issues highlight the need for us all to keep pushing for better collaborative planning and improved connectivity between various service providers across the country and across the sectors, such that gaps don't develop quite so easily in future. Finally, I'd like to turn to another of my colleagues. This is James McVicker. And James was one of our three-person team in Northern Ireland. And once again, I'm pleased to highlight the great support we currently receive from the National Lottery for our work in the province. James and his colleagues Paula and Norman have done a sterling job steering our support service through the many twists and turns since their current project began way back in the summer of 2019, in those golden days before any of us had heard the dreaded word COVID. James is going to share some thoughts with us around the third of our three key areas, specifically accessible social opportunities. Thank you, James.
Yes, thank you, Mike. In this section, we are going to consider the social opportunities available to deafblind people in their local communities. Now, sensory loss is something that spans across the whole community and can impact anyone and everyone. So, looking for a diverse range of opportunities to meet the individual needs and preferences of each person is our goal, if we can all collectively and collaboratively achieve this together. As we have already discussed, for some of us, the COVID pandemic feels like a very long time ago, but for many, especially the deafblind people, they are still feeling its effects. Our shared experience of the COVID lockdown helps us to understand what it's like to need to reconnect, for example, going back to school and work. But for many deafblind people, this continues to be a real challenge. Now, deafblindness can contribute to social isolation due to its restrictive nature of that person's difference. This can affect their mobility, how they access information, and how someone communicates. Our Reconnections initiatives aim to help bridge the gap and get people connected once again with their communities. In some cases, this may mean contacting people on a regular basis, either to have a chat or provide emotional support to help build their confidence. For many, it's about helping them to be self-aware and to realise their own wants or needs, and for us to help facilitate and plan around those choices. One example of this is our work here in Northern Ireland. One of my roles is casework, and this means I get to know the person and then think about their wider social circle and the barriers that they face and how together we can reduce their effects. Our member Alec is a smartly dressed husband and father of two. He has a thing called cone rod dystrophy and struggles with his central vision. Alec is a very stylish man, and his main passion is the fashions of the 1960s and mod clothing. There's a few shops in Belfast which sell these items, but they're all quite far away from his home. We put our heads together and we designed a plan. This involved the recruitment of a specialist volunteer, whom we refer to, as Mike said, as a mobility buddy. We were delighted when a local lady called Kelly answered the call. As it happens, Kelly is also supporting our local social group, which managed to reopen after lockdown. Now together, Alec and Kelly are having regular trips to Belfast. Just having another person be an extra set of eyes and ears can really make all the difference. This allows Alec to refamiliarise himself with the best transport and navigation solutions, so he feels confident making these trips in the future. I mentioned the social group there, as we recognise that we are unable to run our own social groups in every town. We have committed on a national scale to support other providers of mainstream social opportunities to do so in an accessible and inclusive way. To achieve this consistently across a widespread area, we make use of our deafblind friendly assessment and upskilling toolkit, as Mike explained earlier. This provides advice and support to assist the opportunity provider to make relatively simple and practical adjustments and to incorporate good practice which can make a real difference. This means that groups which are not necessarily created for deafblind people are adapted to include them in their own local area. This is done practically by awareness sessions and ongoing support. Now, peer support is very effective in reducing social isolation, and many of these relationships continue outside of the group setting. Now, why do we do all this? Well, we recognise that deafblindness and its experience is more than just the physical difference in the eyes and in the ears. It's about the social circle around that individual, and therefore the need that we have to connect and reconnect is something that we can all understand. As I said earlier, we want the availability of social groups to reflect that individual's wishes of the deafblind community, and all of us are part in that collective solution. That's why it's important for us as organisations to keep in touch in the future so that we can work together in partnership. Now, this is a chance to share good ideas and good working practice that we could all adopt to help provide a more consistently accessible world across all aspects of life, whether it be accessing statutory, non-statutory, or leisure activities. We want to make it so that any activity or resource is accessible for people with sensory loss. And of course, the disruption caused by the pandemic has actually presented us all with an opportunity to review and reshape some of our services. We all have a chance to contribute to positive change for the benefit of the sensory loss and wider community. Over to Mike again.
Thank you so much, James. Absolutely endorse everything you said there.
Sorry, Mike, your microphone isn't working just too well there.
I've unmuted. Is that better? Better?
Maybe you can unmute because there's a bit of a funny noise with it.
How's that?
Well, that's much better. On you go.
Joy. Okay, thank you, James. Yeah, absolutely endorse the sentiments of what you were saying there. Thank you very much indeed for your observations. Clearly, everybody, the subject that we've considered this afternoon is a big one, and it has many aspects to it, and they're all worth considering in greater depth than a short session such as this allows. But it has been really encouraging, I have to say, during many separate conversations that we've had recently, to see the level of interest and passion that exists amongst our communities, both within the industry and sort of in the wider world, to help make meaningful, lasting improvements. We do fervently hope, as we said earlier, that many of you attending today will keep in touch with us here at Deafblind UK, and we warmly welcome the opportunity to collaborate on suggestions and initiatives to promote accessibility, equality and opportunity for all people with sensory loss. I think we've got 1 or 2 minutes remaining, so very briefly, I'm happy to respond to any comments or questions if there are any. If you'd like to submit anything in the chat, I'm not actually seeing. I've got a couple.
Do you have a question in the chat?
Do we? I can't. Can you read it out, James?
Yep. We've got a user that says, "Good morning and greetings from Kingston, Canada." Quick question here. Welcome, Canada. I have a quick question here. As we're seeing a resurgence of COVID-19, as we continue to take precautions, we hear, have you got any recommendations on how we can improve a service user's experience without jeopardizing safety?
Does anybody in the team want to comment on that one? It's yes, as James mentioned earlier, there is still a lot of concern out there about the issues around contagion and the risks that still exist. It's not gone away, and people are aware it's not gone away, but they're not aware of the levels to which it may or may not have gone away, if that makes sense, because the sort of information and misinformation is often contradictory, and of course, as we all appreciate, many people don't access the information channels that the rest of us can access quite so easily. So it's harder for them to form their own judgments, frankly, and they're not sure if what they are hearing or obtaining in terms of information is reliable. I don't think there are any quick wins to answer the question directly, and thank you so much for your question from across the water. I don't honestly think there are any easy answers to that question. It really is, as Caris perhaps most clearly identified, a case of building up the individual's personal levels of confidence to get out there and start trying things again, within sensible boundaries. If that still means that they're making use of PPE or whatever they feel needs to do to make them feel confident and safe, then of course we endorse that. But really, unfortunately, there do appear to be no easy answers to that question. The answer is probably different in different places anyway, frankly. So in terms of a universal panacea, there really ain't one. I don't know whether, James, your observations of the members that you've worked with in Northern Ireland has been similar, has it?
Yeah, I would agree with that, but I would say it's about finding the right balance, because obviously it's the deafblind person's right what they do with the information that they're provided with. So I would suggest that the importance is around having the information about what's going on in an accessible way, whether that be in uh, Braille, large print, audio CD, so that they're armed with that, so that they can make their own choices around that. Of course, I think safety is paramount in all these situations. So, yeah, I would go with that. Yeah.
Thanks, James. I'm going to move on because we've had another quite lengthy question, which I'll just read out. Somebody's asking, I'm currently supporting a deaf-blind man who uses deaf-blind manual to communicate. He is desperate to socialise, but struggles to find appropriate care and support workers who will use deaf-blind manual to communicate. Have you got any suggestions in how he can find more support to socialise? Simple answer is yes. We'd like to have a look at that and see what we can come up with. We mentioned earlier that we have this thing called the Friendship Guarantee. Just to explain what that is, it's literally, it's the sort of tagline for that service is that we want to make sure that any deafblind person, regardless of their circumstances or location, has the opportunity to make and maintain at least one lasting friendship.
Mm-hmm.
So no deafblind person should be without a friend or friends. Now, the solutions to that are multitudinous, as you can imagine, depending on the individual's circumstances, location, aspirations, etc. But we are finding we can usually make some useful suggestions. The issue around the use of deafblind manual is problematic. It will always be problematic because those skills are still in quite short supply, and it's not always easy to find skilled professionals who can use those skills in any given place at any given time. But certainly, excuse me, if I'm assuming this question is coming from somebody within the UK. If I'm correct in that, please do contact us independently through our helplines. We'd like to look into this issue and see what we can do directly in relation to the situation of this particular individual. So please do communicate with us. I can see James wants to jump in, but I was just going to say, if you're outside of the UK, whoever's asking that question, please do come through anyway, because we always like to look at these things and see what we can do to come up with as good ideas. James, what were you going to say?
I have a couple of situations that kind of relate to this, actually. For example, because we have cards and stuff with deafblind manual printed on it. We have some members that I would communicate with using deafblind manual as well. And really it's about empowering that person to be, we don't want them to be shy about what they've got because it's a skill. And the vast amount of people would be interested to learn a new skill. So in the past, I've worked with one individual in particular where him and I have actually went into schools, and one of the purposes is to try and like make people more aware of deafblind manual and of different communication methods. So yeah, that empowerment, and then of course that builds self-confidence that actually, wow, okay, I am deafblind, but I can still do this as well. I can still impart knowledge. And even if they wanted to start small and think of, again, their social circle, their family members, if they wanted to run a brief course around that, we could maybe work with trying to set up things that would, build confidence in how they can do that. So, yeah.
Thank you, James. I'm conscious of time. There's a few questions appearing, so I just want to quickly get a couple more answers in. There's a question here. Somebody's asking, I was wondering, do you provide training or meet with organisations to provide advice on how they aid communication with a deafblind person accessing their services, for example, charitable organisations or women's aid? Simple answer to that one is yes, we absolutely do. and we'd very much like to hear from you. Again, if you could come through on the normal channels through the helpline numbers, we will certainly provide some options for you on that subject. So thank you for asking that question. There's another question, I don't know whether we've covered this one. How do we refer to the friendship service? Also, I think I've described that one already. Hopefully that description was okay. Also, I'd be really interested in working with people to improve deafblind manual use, and they are in the UK, that person. So thank you. Yes, please do get in touch. Let us take that conversation further. As I said, we're hoping today is the starting point for useful, creative and progressive conversation. So please do follow that up with us. We'd love to talk to you. I think is there one on there I've missed, James? Did you notice?
There's a question there around Braille, and it says, as the RNIB this is what the question says, as the RNIB have put Braille on the back burner and is taught less and less, are Deafblind UK teaching that skill? Don't know if you want to go for that one, Mike.
Well, I'm happy to answer that. Yes, we're not currently offering that training. We do have a very active and progressive training department, and we're always looking at what needs to be provided and to whom. So obviously it's all, our decisions are obviously based on areas of need and evidence for a particular requirement. So as I say, if you do feel there are pockets of deficiency in your local areas where certain trainings are not available, please do let us know about it, because that's obviously the starting point for that discussion about whether or not that's something that we, or collaboratively perhaps with some of our partner organisations, we can look at addressing that particular need. But it's very important that you do raise that issue if you think it exists, so thank you for that comment, and please do make sure you continue that conversation with us so it doesn't fall off the agenda. It's all very important. Thank you so much.